1 in 5, or more than 60 million people in the United States, avoid dental care altogether, mostly due to fear and anxiety. Of those that receive regular dental care, 82% will experience some degree of dental anxiety. An anxious response in the human body can be triggered by anything: anticipating the dental appointment, another stressful event, a memory of a past trauma, or just the sight or thought of a needle. Regardless of what triggers the response, it's not anyone's fault and is not something that can be consciously controlled. Realistically, some level of anxiety is an appropriate response when you're reclined in a chair under a bright light and a relative stranger sticks their fingers in sharp metal objects in your mouth. In unfamiliar or threatening situations, the sympathetic nervous system triggers a complex series of chemical signals through the hypothalamic pituitary adrenal or HPA axis. The adrenal glands then secrete cortisol and epinephrine, which is adrenaline, which puts the body in a state of hyperalertness. This response is commonly called the fight or flight syndrome. In addition to the cortisol and adrenaline responses, brainwave frequencies also become elevated to heighten sensory alertness. While we're awake and alert, our brains are functioning in the beta state, where brainwave frequencies range from 13 cycles per second in a relaxed environment to 30 or more cycles per second in a stressful situation. Nucalm's revolutionary technology naturally relaxes the body without drugs and maintains the relaxed state for the duration of the procedure. After over 2 decades of research and 8 years of development, accomplished neuroscientist Dr. G. Blake Holloway began using the Nucalm system to treat patients with severe post-traumatic stress disorder. During development, we identified a profound problem in dental: the need to naturally reduce the effects of anxious behaviors. After 10 months of clinical testing with key opinion leaders in the dental industry, Nucalm was made commercially available for the first time in September of 2010 as an all-natural way to relieve patient anxiety without drugs. We believe that making most dental patients comfortable and relaxed during a procedure will allow dentists to perform safer, faster, and better dentistry. The Nucalm system is complete in 4 simple steps. Step 1, chew all natural tablets. Step 2, apply patches connected to the cranial electrotherapy stimulation, or CES device. Step 3, fit headphones and start the neuroacoustic software embedded in the classical music. Step 4, put on the light blocking glasses. Using 4 simple steps that take under 4 minutes to administer, your patient is just minutes away from a comfortable, relaxed dental appointment. Let's take a look at how the components work together synergistically to relax the body. First, the chewable tablets neutralize the adrenaline-cortisol response associated with the fight-or-flight response. The Step 1 tablet contains L-theanine and casein tryptic hydrolysate, which stimulate the production of alpha brain waves and induce relaxation with their all-natural ingredients derived from natural food sources. The Step 2 tablets contain gamma-aminobutyric acid, known as GABA-A and GABA-B. GABA is the body's primary inhibitory neurotransmitter that balances the effects of adrenaline and cortisol. The brain manufactures GABA every day from our food and uses it every night to wind down the body in preparation for sleep. In the next step, Nucalm uses cranial electrotherapy stimulation. Normally, in an anxious response, the receptor sites will ignore GABA and maintain the state of hyperalertness until the stressful situation passes. The CES device uses a very mild electrical current to open the GABA receptor sites, neutralize the adrenaline response, and start the body's natural slowdown process it follows every night in preparation for sleep. Embedded in tracks of soothing music is Nucalm's proprietary neuroacoustic software. It uses binaural beats and frequency following response technology. Binaural beats are created when we present one frequency in the right ear and another in the left. For example, a frequency of 400 cycles per second is presented in one ear and 410 cycles in the other. In its attempt to synchronize, the midbrain follows the frequency of the 10-cycle difference, taking the patient's brainwave frequency from the beta or high beta state to a relaxed alpha wave state of 8 to 12 cycles per second. Nucalm keeps the brainwave frequency entrained between 8 and 12 cycles per second for the duration of the procedure until the software is stopped. A patient in the alpha brainwave state is physically unable to have an anxious response, though they can have anxious thoughts. As daytime creatures, we're hardwired to be alert during daylight hours to survive. The light blocking glasses used in the Nucalm system eliminate the stimulation of the optic nerve and let the brain know that it's okay to wind down. You know how you feel moments before you fall asleep? You begin to sink into your bed and your arms and your legs feel heavy. You may have daydreams or random thoughts, and you may experience muscle twitching. You feel at peace and physically relaxed. This is the place Nucalm brings you and keeps you there until we stop the music. Even though the neuroscience behind the Nucalm system is complex, it's easily administered in less than 4 minutes.